Okay, well, we are back for another episode of Kind Inside the Treatment Room, and today's quite exciting. One of my guests, Teeghan, who's with us today, we used to work together many years ago, and a lot has changed since then. But for those that are listening to this via the podcast, definitely jump onto Instagram because Project Skin, where we're actually filming today, is divine. It is Teeghan's pride and joy. It is such a beautiful clinic. I will get you to talk about it a little bit more, but you've incorporated quite a lot here. Like you've got skin, you've got health, you've got wellness, you've got injectables, like the whole hog.
Yeah.
Okay. But before we get into it, I think what we might do is like a little brief introduction about yourself, how you got into the skin realm. Way back in the beginning.
Okay. So I have been a beauty therapist since I was 16. I was the first ever student that they accepted into the college where I went to in Tasmania.
Yep.
When I was 16. I've worked for plastic and reconstructive surgeons across the country. I've worked for one of the biggest medi-spas in the country as well. I've run some clinics for other people, and a few years ago I just decided to open my own.
Nice. Yeah. So how far into your career were you when you came to the Gold Coast and we met?
So when I met you, it was about 8 years ago. Yeah.
2018?
Yeah, I think so. Yeah.
We'll just say that.
So
it was before COVID.
Yeah, it was before COVID. So when I met you, I had travelled around the country, worked doing a number of other bits and pieces as well. And I'd actually gone back to Tasmania to finish my studies. So when I was younger, I was working, doing full-time for somebody else. And there was some units that I never actually finished. So before I moved to Queensland, I went back and completed all of my studies and then moved up here. Right. So when I worked with you, I was, it was about 8 years ago.
I think so.
Yeah, because my daughter was really young.
So old.
I know, right?
I think we've both come a long way, definitely. Yeah.
I feel like I was so young then.
Same. So young and naive.
Oh dear.
I've completely changed my whole ethos about how I treat skin, how I see skin, and I think you have as well.
Definitely.
I think the way that we treat and look at the skin is by figuring out also what's happening internally. Where's that stress coming from? Where's that inflammation coming from that are causing those markers within the skin?
Yeah.
And you've ran with that completely with Project Skin, and you've gone far beyond that realm of just treating the skin by also treating the internal matters.
Yeah.
So how have you done that with this clinic?
So for me, when I first started treating skin, I mean, things have evolved so much over the last 19 years or whatever it is. And I think a big part of, what we see when we treat skin obviously isn't just what you see from the outside. So chronic inflammation within the body, even things like stress as well. And when people's cortisol levels are really high and they're not able to be in that fully relaxed state as well, I think everything just goes all over the place. Yeah. So for me, I initially always wanted a bigger space with lots of different things, and it just gradually evolved over time. So here at the moment we have an osteopath. We've got cosmetic injectables. So again, that has shifted away from, the typical lots of filler, lots of enhancements. And we do a lot of the more natural, I guess you could say, approach to that as well. I have some beautiful dermal therapists who work here as well. We work closely with a naturopath, and we have hyperbaric oxygen therapy, full body LED, and HOCATT. So working really deep within the body on a cellular level to fix what we see, what is happening on the inside.
Yeah.
And then obviously what we see on the outside.
On that, and you've got the IV drips as well.
Yeah, and IV vitamin infusions as well. So the girls can, you can script with a doctor. We have a medical director here, so we can script and sort out peptides and things like that. So peptides are huge at the moment as well, but it's all done correctly and done in a lab. So the girls will have a consultation with you. You'll speak to the doctor, work out exactly what's going on, get bloods if necessary, and then you'll be scripted the correct proper lab peptides as opposed to just anything that you get.
And I was reading on with your little booklet here that there's like the heavy metal detoxification as well. What's that about?
The IVs,
let's go with that
so
first.
IVs, you just basically sit down, have a consultation with a nurse, and they can work out a protocol based on what you're experiencing, what your symptoms are, etc.
Yeah, right.
So it's very cool. So everything is internal, external.
It's 100% holistic. That's what you want.
I don't want to be going, well, you have to go and do this, or you have to go and do that somewhere else. It's kind of like, okay, this is what I'm feeling, this is what I'm experiencing, this is how my skin presents. Okay, let's delve in, let's fix it. And then you don't have to go to 50 other appointments.
Well, that's true, because you've got your naturopath.
Yeah.
You've got your doctors on board.
Yeah.
And then you've got your health and wellness machines as well as your skin. So it is even if covering everything.
Even if we have, people who might need some kind of scripts for their skin, which again is way down the track. Like we treat things, we delve into things a lot more than that. But if that is required, we can arrange that too. Yeah. So, yeah.
Cool. Nice.
It's quite cool.
It is, yeah. All right, let's talk more about your machine. So you've got, I'm just trying to think down the massive hallway that we will show you guys soon, the full body LED machine.
Yep.
So talk us through that.
Yeah, so there's about 71,000 LED globes in the machine.
Damn.
So yeah, it's pretty crazy.
Yeah.
A lot of people look at it more past, go, oh, is that a solarium? That just kills me to my soul. It happens.
They've taken the same design of a solarium to make the ease and comfort of having the LED over the whole body.
Yes, so you're getting front and back.
Yep.
And it goes down to 933 nanometers, so it will actually go through the bone. So lots of people with all sorts of ailments. So, chronic inflammation, scarring, acne, and even just overall well-being. Yeah. Like you get out of it and you go, I don't know why, but I feel better.
Yeah.
Because we're oxygenating the cells in not just one part of the body like you typically do with a face or a panel. It's everywhere.
It's everywhere. So is that one just like red light, or does it have near infrared?
Red. Oh, sorry, that one does have near infrared and red.
Both.
Yeah.
Yeah.
Perfect. So you'll see it in there, and again, the globes look very different to what they do on a solarium. So solariums have big. This is the way to tell the difference to anyone. Big tubes is what emits the UV, which can obviously cause melanoma and skin cancers and, aging and things like that. Whereas this, you'll see they're tiny, tiny little globes, one row of red, one row of clear.
And they're a completely different colour to the UV tanning beds.
Yeah, even it's totally different when you get in there.
Completely different. So the reason why I ask about your near infrared, so for those that don't know, LED is really great at reducing inflammation. It also helps to stimulate your fibroblast cells for anti-aging. But your near infrared actually gets into, and this is what you were explaining about recharging and oxygenating the cells. It gets into the mitochondria of the cell, which is like the battery pack of the cell, right? It's the powerhouse. And it increases our adenosine triphosphate. So to get that all over the whole bed, over the whole body is phenomenal.
So we're pushing out all of the bad stuff. This is the way I explain it to people. In your cells, pushing out all of the bad stuff that's in there, oxygenating it. And imagine how much better we function as humans if we have more oxygen in our body.
Right. We thrive on oxygen.
Yeah. So when you can get as much as what you can, why wouldn't you?
Why wouldn't you? Exactly.
Which is why I have a hyperbaric chamber as well.
With your hyperbaric chamber, I've tested out a few. I absolutely love them. If I could afford it, I would be in there every single day. How is yours like different to any others on the market, or is it?
Yeah, I mean, there's a lot of different variations of them. So you do have to be careful with obviously what you're wanting to treat and things like that when you are, opting for one. Ours is what would be classified to a degree as a medical chamber. So it's a hard shell chamber. It goes up to 2 APA, which is quite a fair way below sea level if you're thinking about it like that. But you do breathe in 100% pure oxygen under that pressure. So that's the key when you're looking for a hyperbaric. The pressure that it goes down to and how much oxygen that you're getting.
Okay. I did have a question about hyperbaric chambers. So there are hyperbaric oxygen chambers in specific hospitals. How do the chambers that you and other wellness businesses have compare to those? Like, are they very similar?
Very similar. Well, it depends again. So some are very similar, some are not.
Okay.
So hard shell chambers, you're probably not going to be breathing in that 100% pure, soft shell chambers, you're not going to be breathing in that 100% pure oxygen. Yeah. Now, when you're in a hospital setting and you're being treated for like the bends and things like that, now that's a whole nother realm that I wouldn't even enter into. The chambers then will go down to like 3 APA, which is a lot. And that has to be done under medical supervision. Can be quite dangerous as well. I don't want to scare anyone, but you can have issues arise from that. So they're the chambers that you would never take any technology into. Cotton only, no deodorants, be careful what you're wearing, your shampoos, things like that. Right. So it's very, very strict. With my chamber, I mean, in terms of this setting and what I'm looking to treat, you still get a fantastic result and it is still classified as medical, but we're not delving into that area of, I guess, the hospital type setting.
What type of people would come in to have a hyperbaric oxygen chamber session?
Anyone.
Well,
again, with contraindications,
with limitations.
Yeah, so as long as you don't have any like severe respiratory issues, obviously claustrophobia is a big one for some people who suffer with that. Majority of people could use it. So we have people really young, to be honest. I even put my son in there, so my son and my husband will go in there. Perfect, sometimes. Regulates, brings them a little bit down. I guess he's 5, so he's a little bit crazy. We've got other younger children who are 11, 12 who might have a little bit of autism or ADHD, and it just helps with regulation. Cancer patients, people with bad knees from accidents, all sorts, to be honest. Post-surgery recovery. These days, there's a lot of facelift type stuff happening, breast augmentations, rhinoplasties, all this kind of thing that we see clients for post-surgery recovery and things like that. So hyperbaric is fantastic for that.
And how often can you have a session? Like, can I come in every day?
Well, it depends on what you're trying to treat.
Okay.
So that's a broad question because there's so many different things that we treat. So a couple of times a week, 3 times a week, 4 times a week, again, depending on what we're trying to achieve.
Right.
But a good amount for me, for general wellness, if we're wanting to feel good 2 times a week.
Okay, perfect. That's
3
doable.
if you've got time to push it a little bit more.
Yeah, because how long are you in there for?
Anywhere from 45 minutes to an hour and a half.
Right, and you completely switch off when you're in there. No
so
phones.
We have some clients who will go to a lower pressure and they will want to take their mobile phone in or, listen to a podcast or something like that. If we're at a lower pressure, then we allow that because sometimes we want that relaxation music. You want to sit down and have that time, that 45 minutes to listen to that podcast. The higher we go up in pressure is where we're a little bit more strict. Yeah. And we don't allow the devices. So you'll go in there sometimes and people will be curled up in the pillow in the corner having a nap.
And then moving along down the modalities that you've got, we're going to talk more about the HOCATT when we have a little test of that one. So that'll be really fun for everyone to see on the visuals over on Instagram. But skin treatment-wise, what do you do here at Project Skin?
Be short a list of what we don't do.
It's a long menu.
It's a long menu, but everything has its purpose, right? So for me, it was a little bit of trial and error in terms of products and all of that kind of stuff. And I've really finally found my groove a couple of years on. But, anything from skin needling to HIFU to radio frequency, obviously our injectable side of it as well. We have beautiful relaxing facials, calming, restorative treatments, as well as, chemical peels and the works. But we are very strict on, and I will say this, given the fact that we do so many things, the skin has to be functioning correctly and working as it should before we will delve into anything. So I will have clients call and be like, I want a really strong chemical peel, or I want to do this, and we just don't do that. And I won't either. So a lot of my clients will tell you a majority of our appointments are just booked for time. So you and I would know, being therapists of so long. Back then you would be, okay, this client's having this treatment, these are the products we use, you have to be in and out of the room within this amount of time, and it has to be turned over, and you've got to be ready to take your next one in within the hour. I just don't work like that.
No, good.
And I know you don't.
We shouldn't do it that way.
No. So we have a very different approach for that kind of stuff as well. So we allow extra time you come in, you pick your scents, which I think is really important as well. So, you can select the scent that goes on your towel or in your HOCATT machine or in the diffuser in the room. And all of our treatments are done on sound therapy beds. So even if you're having something intense like HIFU or radio frequency, we do try and maintain that really relaxing experience because it's so important for your treatment outcome.
What's the vibrational sound bed?
It's amazing.
What are we talking about
here?
Before? I have heard about them, but I've never experienced them.
It's pretty amazing. So the idea behind it is nervous system regulation. So the music that actually comes through the bed, it's like a mattress basically. So the beds are super comfortable. The mattress itself will actually vibrate to the frequency that you set it on, and the music itself comes out of the bed as well. So while you're laying in there, you can hold on to this pillow. You give it a good squeeze, a really good hug while you're in there. And honestly, within a couple of minutes, we set it on all sorts of frequencies depending on what the client's feeling like. But generally, it's calming, relaxing, nervous system regulation, because I feel like the majority of people need that these days. And yeah, it's just a different experience to your treatment. It just relaxes you that little bit more.
Yeah. Does that release any PEMF, or is that separate?
No, that's separate. We do have PEMF as well, and we can opt to put the mats on the bed for PEMF over the top of the sound therapy. But that's optional for clients as well. But we generally do the vibrational for all of the treatments that we do in our skin rooms. So, and I think the big thing as well is, people go in and everything's so in, out these days. And that to me drives me crazy. So we don't do that. Everything is very relaxed. We also limit the amount of people that are in here at any one time as well. So you may see that we have 10 big, huge rooms in here, but you'll never walk in here and there won't be like 12 people sitting in the waiting room, because I feel like it's overwhelming for starters, and people are here to relax. So we kind of limit the amount of staff that are here at any one time. So when people come in, it really is just your time to relax and get our undivided attention.
Beautiful. Yeah. So let's step back a bit to what you were talking about when you see a client and they want that intense treatment, but you're like, no, we need to go do the foundations first. Talk to everyone a little bit more about that and why it's so important with what we do.
Well, if the foundations of the skin aren't working, you can treat it with anything, but it's not going to do anything, right?
Yeah. And what do you mean by we know this. But what do you mean by foundations?
So we need to make sure that the skin is hydrated, our skin barrier is functioning correctly, our internals are working properly. So things like essential fatty acids and things like that would help that foundation inside.
Just lower that inflammation.
Yeah, lowering inflammation, lowering stress within the body, making sure the barrier is functioning, making sure the skin is at that homeostasis, so that really optimal functioning level. And you can see that to the eye, right? When you're treating your skin, you can look at someone almost instantly and go, there is no way you're having that today. And explain to them why,
But what do you find is causing that?
A lot of the time it's stress and inflammation within the body. And a lot of gut issues, lots, which again, inflammation. It all leads to the same thing, right?
Definitely. Do you feel like people have been incorrectly treated or maybe prescribed the incorrect skincare from other places?
I see it often.
Yeah.
So, again, we've been down this route before with, different places that you work, but it is a sales pitch. That is the bottom line. Like, you go into a place and they are paid to sell you something, right? They may know what they're talking about, but at the end of the day, they have to get a sale out of you. Correct?
100%. I always let people know beauty is probably the biggest marketed industry in the whole entire world.
That is why.
A lot of it is so sorry.
No, that's why you've got to pick your person correctly.
Yes.
Because you will be going to someone who's selling you something because they have to, not because it's the right thing for you.
Exactly.
And I always give my clients the option. If it's a monetary issue, which it is and it can be, I would rather my clients take the correct thing home, use that, and see me in the clinic every 6 months if they have to. Ideally we would see more than that, but if that's the case, then that's how we treat.
Yeah. I think you and I can talk skin till the stars come up. Like it's in our blood. I absolutely love it. Well, I think we should get started on a bit more of these modalities. Yes. We're going to try a bit of HOCATT. And then we'll talk a bit more about that and maybe some molecular
we'll
hydrogen.
Get the booster.
Yeah. All right, cool.
Done. Okay, so
we are inside the HOCATT machine. What does HOCATT stand for?
let me tell you. Hypothermic ozone carbonic acid transdermal therapy.
Okay.
Okay.
Perfect. So we are here inside the HOCATT machine, and basically what it is, it feels like a giant sauna. So I'm a little bit naked underneath. And I'm holding on to electrodes, which are pulse electromagnetic.
Yeah.
Yeah, perfect. Explain to us, why am I in here?
Why are we in here? Okay, so the whole idea of a HOCATT is, I call it a full body detox. Okay, so when we're in here, we're heating you up to anywhere from 40 to 42 degrees, depending on the client, depending on how many sessions they've had, that type of thing. Feels like a sauna, but it's better than a sauna because your head actually pokes out, right? So if you're sitting in a sauna at home, you're sitting there and profusely sweating, and you get out and you feel gross.
And it doesn't feel like I'm suffocating and gasping for
Yes,
air.
it feels nice, doesn't it?
Pleasant.
So for the first 3 minutes, carbon dioxide is going to come out the back of the chamber. Okay, when that hits, ooh, you can feel it?
Yes.
When that hits the water inside the chamber, it turns to carbonic acid. Okay, and carbonic acid is fantastic for the body. Circulation, blood flow, cellular health, there's so many different benefits. So the first 3 minutes that will go through the chamber, and then after that the ozone will go in. Okay. So it's an ozone, carbonic acid / heat / electrodes. There's so many things going on in here. So it's very different to a normal sauna.
Now I might ooh and ah through this recording. I'm holding electrodes. They're not in any way, like I'm not getting an electrical shock here like a Thames machine, but it's just a slight little buzzing that you don't expect every now and again.
And look, some people, and it depends on what program that we put you on. So there's so many different programs that we can have. I think there's close to 200. I've got a little booklet here.
Wow.
So we've selected for you stress relief, basically. So this one I don't find is too bad. There may be a few zaps in that one that you'll go, oh, that's a little bit much. But we're kind of trying to, when we're stress relieving, right, we're trying to be calm. So we don't want those huge big zaps in this one. When we're doing like a heavy metal detox or a full detox or inflammation, they are quite intense. And I always say to people, just close your eyes, breathe through it, take a few deep breaths. If it gets too much, drop the electrodes beside you and pick them back up when you're ready. If you've got like a particular ailment, so I've got some gentlemen who have golfing injuries or knee injuries, they can tend to feel the pulses and the zaps through the head that they need it the most. And even one of my therapists, she has
carpal tunnel
from repetitive strain, and she said the same. She could feel it really hard. I think it was in her right hand, and then after one session she was not experiencing any pain.
That's amazing.
So I never say that one session is going to change the world at all.
You don't know how people will heal.
That's right. And one of anything, is going to be great. You're going to feel really good. But in terms of if we're really trying to reach something or trying to treat something, we need to do this more than once. Even my dad actually came in here once with severe gout in his toe. So suffers from really bad gout and arthritis, rheumatoid arthritis. And he was like hobbling, right? When he walked in the door, he's like, God, Teeghan, my toe's really sore. I was like, okay, get in the HOCATT. We set it on the gout setting.
There's a gout setting?
There's a setting for gout. Set him on that, put him in here for half an hour, had him up at about 40 degrees, had his ozone quite high as well because he's had the treatment before. And then after he left this, I put him in the LED bed for 20 minutes. After this and the LED, he could actually wiggle his toe, and it was reduced in size by half because obviously when we get gout, things swell. It was half. And he still had a little bit of a limp when he walked out, but he was able to walk out a lot more freely than what he was when he first came in. And that was after one. So you could only imagine continuous treatments on things like gout, arthritis. There's settings for cancer in here. There's settings for different parasites, heavy metals, all sorts of stuff. Insomnia, if you're not sleeping very well.
What about thyroid, autoimmune disorders?
I'll pick up my little piece of paper here. So I've highlighted, everyone can probably see this on the camera if you're looking. This is only half of our booklet. So absolutely, anxiety, Alzheimer's, we can treat acne, muscle pain and injury, osteoporosis, thousands of different parasites, not thousands, but lots.
Alzheimer's is amazing.
Pancreas, what else have we got? Prostate, influenza, wound healing, Lyme disease. Honestly, it's crazy.
And so I'm assuming it's very similar to the hyperbaric chamber in the sense of it depends on what you're treating as to how often we do it.
Yeah,
but like approximately, is it still
2 times a week is a good number. I've got people who use it twice a week religiously, so Tuesdays and Thursdays every week, because they just love it. They love how it makes them feel. I've got a lady who I've been treating her skin for quite a while. She's, I would say, in her 60s. I absolutely loves this. So has done it twice a week since I've had it, except for when she's been away, of course. The difference in her skin over her entire body, reduction of redness in her cheeks. She used to have really quite flushed cheeks, pretty much gone. Even her skin. Now we know when we age, our skin becomes a little bit crepey, a little bit thinner, you know, a little bit more delicate. Yeah. Honestly, it's taken years off her arms. Wow. It's actually crazy. And the whites of her eyes are now pure white. So she looks really healthy.
And that's twice a week?
Twice a week since November last year. She's been doing it with the LED full body bed. Yeah. And we treat her skin holistically as well.
Yeah, right. Would you do packages of this?
We do packages of these. That's one thing that I will do packages of, because I know the benefit of, you know, doing obviously more than one. So these we recommend either 5 or 10, same with the LED and same with the hyperbaric.
Okay, perfect.
How you feeling?
Good. It's honestly, it's not too hot. I thought I would be really scared. Saunas aren't my greatest of friends.
Me either.
I can barely handle an infrared sauna. I'm like, 5 minutes in, I'm
I
done.
get really hot, really flustered, and I actually feel gross in them.
Yeah.
I don't like it. No. And then you get out and you feel like you've got to have a shower.
Yeah.
Like you just feel, ugh.
This is a little bit of, like, I can feel the moisture on the bottom of my feet where I'm touching it, and obviously where I'm holding the electrodes. Other than that, it's fine. Yeah, it's so fine.
And the good thing with this as well, so you feel like you're kind of in a sauna, but you get out and you feel clean.
Okay.
Because we're like detoxifying everything from your skin. You will smell your skin and you'll feel like a little bit of a metallic smell on it, but you actually are recommended not to shower for between 3 and 7 hours after a treatment, just because it will continue to work on a cellular level for that long after. Yeah. So I would suggest after we finish today, at least 3 hours, but you won't feel like you need to have a shower like you do in a sauna. You get out of sauna and you're like, oh, gross.
I've got quite a little bit of sensitive skin. And when I hop out of a sauna, even the next day, I'm icing my face because that heat in my skin and in my face, it's not good for me.
Yeah.
What would you recommend for people, say with rosacea, who can't have saunas?
Well, I do have clients who use this who have rosacea. Yeah. We monitor the heat, so I'm obviously in control of how hot we take it. So for you, we've got you at 40 degrees. Potentially with someone with rosacea, we might do a 38 to 39 degrees, but the head's out.
Okay.
Right.
Yeah.
And I've never had
under the air conditioning, so it's still nice and cold.
Air conditioning. We've got a fan behind you, which keeps going, you know, throughout the course of the treatment. I've never ever had anyone have any issues with rosacea from the treatment. In actual fact, it's quite beneficial, right? Because you're detoxifying, reducing inflammation. So that little bit of heat that you might get in the skin initially, long term, I've never had any problems.
No, I think you would get more heat underneath the steamer and a facial than you would with this.
With this, definitely. And again, if I had someone present to me with extremely red skin, you know what I mean? You know, very vascular, very red, very sensitive, I'm not going to do this straight away, right? No. We're going to go, okay, let's look at some other modalities to 100%. Help fix that, restore the skin, make sure we're balanced, and then we can look at doing something like this as well. So it's just...
That's why it's important to go to someone who knows what they're doing, someone who understands skin as well as these modalities.
With this particular one as well, so if you've got, you know, high blood pressure, things like that, we will do consents and we will talk about your medical history and things like that as well. Some people, you know, have a really high resting heart rate, so we will monitor that in there as well with the heart rate monitor that you've got. If the heart rate's getting too high, I'll just cut it at a certain point and we'll do a shorter treatment. So it's very much, we do consult you and make sure that, you know, you're the right candidate for it.
Yeah. So my heart rate's currently sitting at what, 91?
91, which is
high?
No, it's not high. I mean, we've had people in here that their resting heart rate is 110 to 120, which is wild. Like you can imagine the stress on the body when your heart rate currently sits at that all the time. So what I find with this as well, majority of people, when you first got in here, your heart rate was 80. Bonza. Perfect. It's dropped down now. Okay, so when we get flushes of heat come through the chamber, it will elevate the heart rate. Okay. And when you get shocks on the electrodes, that will also elevate the heart rate. See? Yeah. And then once you relax, and if you take some deep breaths and regulate your heart rate by yourself through your breathing, that will drop.
Perfect.
So that is completely fine.
Where you want to be.
Yeah.
Yeah. Okay.
And you will, as you're reading the screen as well, you will probably see that too. So now we're back down to 89. So if I let you sit in here and dim the lights and let you rest, like relax and, you know, focus on your breathing, I could guarantee that it'd come down to about 85.
Yeah. And so one treatment session of this is 30, 40 minutes?
Yeah, 30 minutes in the chamber itself. So all up, you'll probably be here for about 45 by the time we explain it and you get yourself ready after your treatment. But yeah, 30 minutes you'll sit in the chamber. If you're not sure about it and how you think you'll handle it, we can do either a 15 or 20 minute session to start with. Yeah. But we also aren't the clinic that goes, okay, Danny, see you later.
Bye.
See ya. We just don't do that. So that 30 minutes that you're booked in, either myself, the nurses, the other therapists, our clinic coordinator who is a therapist as well, we're in here with you, either checking on you or, you know, we'll dim the lights. Some people don't want to do that because they get a little bit anxious over that. So we've got the TV and we can put Netflix on the TV.
Okay.
So we'll chat to you through the whole process. We'll duck out, let you have a rest and a relax, and then poke our head back in, make sure that you're okay. If you need anything.
Coming at it from all angles.
Yeah. Well, I think, again, people are coming in and they're wanting a service and they're paying for your time, right? You don't want to come in here and pay to sit in here and then me disappear.
But it's also nice to have the options of being in here on your own and just chilling out.
And once you're used to it.
Stimulants.
Yeah. Once you're used to it, people will be like, no, I'm good. You're fine. And then we'll just close the curtain and then you'll be having your nap with your head beside you. And I'll open the curtain, make sure you're okay. And I, you know, tip your toe in here, check your heart rate, make sure everything's all good. And then I duck off again. Right. So you don't even know that I'm here if you don't want me to, you know, if you don't want to.
Yeah.
Some people, I'll sit on the chair and we'll gas bag the whole time. And we'll watch a Netflix show together.
Could do that. Yeah. And so for those that want to incorporate a couple of modalities at once, as you were saying, you can do molecular hydrogen whilst you're in here or in the LED bed.
We definitely can, and we can hook you up to this. So this is our little molecular hydrogen booster. So this will just feel like a nice little cool breeze going up your nose. Doesn't have to go all the way up. It can just sit on the side there, but give me a second and I'll fiddle around with it. How's that feel?
Perfect.
In the right spot?
Nice.
That's also a really good add-on to the HOCATT as well, because obviously you've got ozone in here, right? Ozone transdermally, fantastic. Really good for detoxification purposes, really good for the skin. But if we're breathing in ozone, and this is why we have the towel around your head, sometimes we'll use a plastic shield. I actually hate the plastic shields. I feel like they're quite uncomfortable around your neck. So we just monitor and make sure that the towel is around there enough to not be breathing in a whole heap. But this is giving you that hydrogen, that molecular hydrogen, so you're not also breathing in the ozone, you know, vapors that come out of the machine as well. And you can add this on, a lot of people will go from the HOCATT with the molecular hydrogen, or they'll go into LED with the molecular hydrogen. So that typically when people come, they do both of those. And then, you know, they might come back another time and then do the hyperbaric, which is a session on its own.
So why do molecular hydrogen? What is it? How does it benefit us?
Yeah, so molecular hydrogen is the smallest atom in the world, penetrates through the blood-brain barrier. So really good for cognitive function, focus, inflammation. So breathing in molecular hydrogen, this feels amazing. How does it compare to drinking hydrogen water? So hydrogen water, you'll get a smaller percentage of the hydrogen and it'll get lost through your gut. Whereas when you're breathing it in like this, it's going through the lungs and to the bloodstream in a higher concentration. So you'll get more of an effect from it.
Right. Okay, cool. And once again, my favorite question, how many times can someone have
this
molecular hydrogen?
You can't overdo it.
No.
You could use this every day if you wanted to for half an hour.
Okay.
And you can't overdo it.
Yeah. People with like pneumonia, respiratory issues, are they okay to use it?
Absolutely. Yeah, you'll feel it. It's only a tiny little bit, isn't it? Yeah. It's quite.
It's like a cool little breeze up your nostrils.
Yeah.
You've got everything: the IVs, the skin, all your devices. So what's next for Teeghan and Project Skin? You're an ambitious woman. You've always got something cooking.
Oh, look, we'll see. I would like another clinic. That's the plan. I want multiple.
Yeah.
So we will see where the next you know, let's just give me a minute. I only just opened this one last year. But yeah, I'd like 2 or 3. I've got my eyes peeled for, you know, the right things that come about. But I think as well, I don't know, it has to be done properly. If it's not done properly, I don't want to do it. And this, I'm really proud of it here. And
you should be proud of it. This is amazing.
Yeah, I'm really happy with kind of where we've got to in such a short space of time.
Yeah, perfect. I mean, as I said, you've incorporated pretty much everything into this space that you could really well.
Thanks.
Yeah, you've done good, kid. You've done good.
Thank you.
So what I'm feeling inside is still very similar to what I was feeling at the beginning. A little bit more sweatier, like around the hands. I think that's just more because I'm holding on to a metal rod.
Yeah.
Like if I wasn't holding on to something, probably wouldn't feel too sweaty. I can feel a little bit of sweat at the back of my knees, but it's still not as hot as what I thought it was going to be. It's actually quite comfortable. I was going to ask in relation to exercising.
Yeah.
So is this an after exercise modality that you could do, or?
Yeah, you can, but I would say not right away. So I would, you know, not be going to do your big run and then come in here and do this straight away because your heart rate's going to be elevated as it is. You can definitely go and do your exercise in the morning and then go home, have a rest, have your shower, do whatever you want, and then come in and use it. And vice versa as well. Okay, we don't want to overdo it. Like if you're going to go and do this, I'm not going to say, Danny, wipe yourself off, go and put your Pilates clothes on and go and do your Pilates class.
Yeah.
I mean, some people probably could, but is it necessary? Probably not.
Yeah.
And you've got to remember as well, this isn't just a typical sauna. Okay, so you know, you go into a sauna, you're sweating, you might get a little bit of infrared light in there. This is not that. So there is so many things happening in here on a cellular level in your body that we obviously can't see. So best to err on the side of caution and treat your body with respect after you're doing it, right?
Okay. And what about women when they're menstruating? Is there a particular time of month that they can and can't do it? You
can do this while you're menstruating as well. It's no problem at all.
Does it alleviate any symptoms that you know of?
Can do, yeah. Okay. There is a setting for even endometriosis. There's some settings on there for PCOS as well.
Wow.
And also the inflammation ones, right? Because we get quite heavy, quite bloated. It does definitely help with that. So, yeah, totally fine.
Perfect.
As long as you're comfortable to do it, it's no problem.